She was only 24, perfectly healthy, no symptoms. And yet, there it was, a rock-hard mass, nearly the size of an orange, growing quietly under her arm. Her first thought? Cancer. Her doctor's first thought? Let's wait and see. But what if waiting was the worst decision of all? Why do young, healthy people get hit with terrifying symptoms, while others ignore them and walk away fine? And what saved her in the end wasn't a biopsy or a machine. It was one simple question, asked at the last possible moment. If you believe real stories can save lives, hit subscribe, because the next one could be about someone like you. It was just past 9 a.m. when I first saw her sitting in the corner of the waiting room. She had one arm crossed tightly across her chest, cradling her left side as if trying to hold something in place. Her name was Emily. She was 24 years old, and from across the room, she looked like any other. Young adult, jeans, sneakers, a sweatshirt a little too big for her slim frame. But her eyes were scanning everything like she was preparing for battle, and sitting beside her was an older woman, gripping her hand so tightly that both of their knuckles had gone white. I would later learn this was her mother, Mrs. Carter. The air in the clinic was cool, sterile. The buzz of the fluorescent lights above was almost loud enough to drown out the quiet tapping of a foot. Hers, restless, anxious, as if the floor couldn't be trusted. I wasn't scheduled to see patients directly that day. I was precepting, overseeing our residents as they took on their own cases. My role was mostly supervisory. Check their notes, guide their decisions, correct course if needed. The heavy lifting belonged to them now. At least it was supposed to. One of the newer residents, Dr. Lynn, knocked lightly on my office door. She was bright, attentive, the kind of young doctor you want to see succeed. But when she stepped in, something about her demeanor told me this wasn't a straightforward case. "I have a patient I'd like you to take a look at," she said carefully. I raised an eyebrow. "What's the story?" 24-year-old female, she began. Came in this morning with a large mass under her left arm. She says it's been there for 5 days. Painful the first 2, now just a dull ache. No recent fevers. No trauma. No signs of skin infection. It's big, Dr. Marcus. Like the size of a small orange. My brows furrowed. Mobile? Yes. Tender? A little. Not red. No warmth. She says it hasn't changed in size since it appeared. I leaned back in my chair, tapping a pen against the desk. This wasn't uncommon, necessarily. People come in with lumps all the time, swollen lymph nodes, cysts, infected hair follicles. But 5 days of a persistent mass that size, with no clear source, that wasn't something I wanted to leave in the hands of a resident. "Let's go take a look," I said. When I entered the exam room, Emily looked up immediately. Her mother stood, half expecting bad news before I'd even said a word. "Hi, Emily," I said with a soft smile. "I'm Dr. Marcus. I help supervise the team here. Dr. Lynn told me a little bit about what's going on. Mind if I ask you some questions and take a look?" Emily nodded. "Please." Her voice was tight, cautious. I could tell she was trying to keep it together. "I know this might sound silly," she said suddenly, "but I just need to know it's not cancer." I looked at her, then at her mother, who was already blinking back tears. "It's never silly to be concerned," I said gently. "Let's figure this out together." I asked her a series of questions. No recent illnesses, no infections, no unusual physical activity, no changes in diet or routine. She wasn't on any medications, had no allergies. Her last physical had been just a month ago, with completely normal labs. She hadn't shaved recently. No irritation, no insect bites. And yet here we were. I asked her to raise her arm, and I moved slowly, carefully, palpating the area. The mass was deep, deeper than your average lymph node swelling. About 8 centimeters across, firm but not rock hard, mobile, somewhat tender to the touch. It didn't feel like a cyst. It didn't feel like an abscess either. And it definitely didn't feel like nothing. Behind my calm voice and professional hands, my mind was already sprinting through a list of differential diagnoses. Lymphoma, sarcoma, a reactive lymph node gone rogue. Maybe an unusual presentation of a viral infection? But what I was really feeling was that tight pull in my gut, that rare, uneasy feeling you get when something isn't behaving the way it should. I glanced at Emily. She was watching me closely, searching my face for any sign that I knew what it was. that I had an answer, that I could tell her right now that she didn't have to be afraid. But I couldn't say that, not yet. You said the pain's better now? I asked. She nodded. Yeah. It was like a 6 the first day. Now it's like a 3 or 4. More annoying than anything. I stepped back, removed my gloves, and took a deep breath. There are moments in medicine when instinct whispers before the science catches up. And right then, instinct was whispering to me, don't let this go. Her mother broke the silence. She's never sick, she said, her voice cracking. Never. She's always been healthy. Please. This can't be something serious. She's only 24. I looked at them both. Let me take a little more time to think this through, I said. We're not jumping to conclusions, but I want to be thorough, okay? They both nodded. I could see the relief in their eyes that at least someone was taking this seriously. As I left the room, I could still feel the mass under my fingers. 8 centimeters of mystery, too big to ignore, too quiet to understand, yet. And I couldn't help but think back to a case from years ago. Another young woman, a moment when I hadn't listened to the little voice that said, look again. This time, I would listen. The door clicked shut behind me, but my thoughts didn't follow me out. I stood there in the hallway for a moment, processing what I had just felt. That mass under Emily's arm wasn't textbook. It didn't announce itself as benign or malignant. It just existed. Big, quiet, and strange. Back in my office, I sat down and looked at my screen, but the notes in front of me blurred. My mind had already taken a sharp left turn, backwards, back to 5 years ago. Her name was Lisa. She was 31, a freelance photographer, the kind who carried a camera like it was an extension of her body. She came into the clinic with a lump in her neck. Small, about 2 centimeters. She was laughing when she walked in, said she thought it was from sleeping weird or lifting her camera gear too often. I'd examined it. Mobile, soft, no fever, no weight loss, no night sweats, healthy otherwise. I'd chalked it up to a reactive lymph node. Told her to come back in 2 weeks if it didn't go away. She came back 6 months later. By then the lump had doubled in size. She had night sweats, fatigue, unexplained bruises. And by then, it was too late. Stage 4 lymphoma. Her mother called me 6 months after that to let me know she had passed. I never forgot that call, or her voice, or the silence that followed it. As a doctor, you carry things, not just stethoscopes and pagers. You carry faces, missed opportunities, decisions that seemed small at the time but meant everything in hindsight. Lisa's face stayed with me. Every time I touched a lymph node, her memory whispered, don't assume. That's why Emily's case hit a nerve. Same age range, same soft-spoken personality, same air of, I don't want to make a fuss, but I need to know. And there I was again, faced with a lump and a choice. To a medical student, a lump is a finding. To me, it's a crossroads. I tapped my pen against the desk, resisting the urge to order every test under the sun. Panic helps no one. But dismissiveness? That's worse. Much worse. There's a thin line between being calm and being careless. I've danced too close to it before. Dr. Lin knocked again gently, bringing me back to the present. She stepped in, looking concerned. She's really nervous, she said. Her mom too. I nodded. Understandably so. She asked me what I thought, if I thought it was cancer. Dr. Lin hesitated. I didn't know what to say. You said the right thing, I replied. You told her you don't know, and that's okay. That's honest. Patients respect that more than false certainty. Dr. Lin sat down. Do you think it is? Honestly, I sighed. I don't know yet. It's not acting like an infection. It doesn't feel like a cyst. It doesn't scream cancer, but it doesn't whisper harmless either. It's ambiguous, and I hate ambiguous. She nodded slowly. What now? We build a differential. We ask better questions. We don't jump to conclusions, but we also don't sit on our hands. And we definitely don't let her leave without a plan. I opened a blank note on my computer, labeled it Emily Carter, preliminary thoughts, and began typing. History of present illness. 8 centimeters axillary mass. Subacute onset. Minimally. Tender. Non-erythematous. Mobile. Deep to skin. No overlying skin changes. No systemic symptoms reported. Patient appears anxious. Family visibly distressed. Plan. Continue investigation. Consider imaging, labs, and if necessary, referral to surgery, but also Consider everything. That last part, I didn't type, but I thought it. There's an unspoken rule in family medicine. You don't go fishing unless you're ready to reel something in. But sometimes, it's not about the big catch. Sometimes, it's about not letting the wrong one slip away. I stood up, grabbing my tablet, and said, "Let's go talk to her again. I want to try something." We walked back to the exam room. Before opening the door, I paused. "Lynn," I said, "the difference between a good doctor and a great one isn't just knowledge. It's humility. And memory." She tilted her head. "Memory." I looked at her. "You remember the ones you lost, and you let them teach you, not haunt you." She said nothing, but I saw her expression shift. A quiet kind of understanding passed between us. Then I opened the door, and we stepped back into the storm. Emily sat upright now, back rigid, like someone preparing to receive a verdict. Her mother had both hands clasped in her lap, knuckles pale. "I know this is a lot," I began, "and I know you're scared, so let me tell you where we are. You have a lump. It's not clearly dangerous, but it's not clearly safe either. We don't know yet, and that's not a bad place to be. It's just a starting point." Emily exhaled. It was the first real breath she'd taken since we walked in. "So what does that mean?" she asked. "It means we're not rushing, but we're not waiting either. We're investigating, carefully, thoroughly, and together." For a moment the room was still. Then Emily nodded. "Thank you," she said quietly. Dr. Lynn and I exchanged a glance. I knew she was learning, and I hoped Emily felt, at least a little, that she was in safe hands. Because this time, I wasn't going to miss it. Emily lay back slowly on the examination table, shifting with the tentative movements of someone not wanting to disturb something fragile inside them. I watched her carefully, not just as a physician, but as a listener. Bodies speak, even when mouths stay quiet. "Can you lift your left arm for me?" I asked. She hesitated only a second before complying, her sweatshirt sleeve falling back to reveal pale, unblemished skin. As she raised her arm, her face contorted, not a sharp wince, but the subtle grimace of discomfort that hadn't fully settled into pain. That said something. I put on a new pair of gloves and stepped closer, crouching slightly to get a better angle. There it was, nestled in the hollow of her armpit, just where the pectoral muscle begins. To curve downward into the sidewall of the thorax, the mass stood out. Or more accurately, it bulged, smooth against the skin but visibly pushing from within, like a submerged stone under fabric. I reached out and palpated gently. It was large, larger than I had expected even after hearing Dr. Lynn's description. Roughly 8 centimeters, about the size of a medium orange. Deep, mobile, but with some resistance. Not fixed to the skin, but not entirely loose either. Slightly tender, not warm to the touch. There were no signs of surface infection. No redness, no heat, no discharge, no visible puncture marks. The overlying skin wasn't taut or shiny, which ruled out most fluid collections or abscesses. It wasn't squishy like a cyst. It wasn't rock hard either, the way some tumors present. It was something else. As I worked, Emily's breathing quickened slightly. She was trying to stay composed, but I could see it wearing on her. I spoke gently, trying to offer calm in the middle of the unknown. "You're doing great," I said. "I know this isn't comfortable." She nodded, barely moving. "It doesn't really hurt, just pressure. Has it changed at all over the past 5 days?" "No. It was like this from day one. Same size, same spot. It just showed up." I straightened and stepped back, pulling off my gloves. I sanitized my hands slowly, buying myself a moment to think. Dr. Lynn stood nearby, watching intently, her hands folded in front of her. I looked to her. "Want to walk through it with me?" I asked. She perked up, slightly nervous but ready. "Sure." I gestured toward the mass. "It's large, mobile, not warm, not red, not tender to percussion. What's your differential?" She spoke slowly, choosing her words. "Reactive lymphadenopathy? Maybe from a local infection?" "Good," I nodded. "But she has no signs of infection, no recent illness, no trauma. What else? Lipoma?" "Too firm," I replied. "And lipomas usually grow slowly. This came on in days." Dr. Lynn hesitated. "Malignancy?" I nodded again, more solemnly, always on the table. Emily, listening to all this, turned her head toward me. "Wait, cancer?" I knelt down slightly so we were eye to eye. We're not jumping to conclusions, Emily. It's just part of what we have to consider. Lymph nodes can swell for many reasons, most of them benign. But we have to think about everything. She didn't respond immediately. Her eyes began to well up, and I saw her mother reach for her hand again, squeezing it tightly. That silent grip said more than words ever could. I continued, trying to balance honesty with hope. There are a few things that make this tricky, I explained. It's deep, not superficial. It's large, but not painful in the way infections often are. It hasn't changed, which is unusual. And you're healthy. No illness, no fevers, no recent viruses. So I don't want to dismiss it, and I don't want to overreact. I want to understand it. Emily looked at me. How? We ask questions, lots of them. And we look at everything around it. Sometimes a lump is just a lump, but sometimes it's a signpost, something deeper. Our job is to find out which. Dr. Lin looked down at her tablet, already jotting notes. I could tell she was learning. This wasn't a textbook case, and she knew it. I took a deep breath. I want to go back through your history again, every detail, even things that seem unrelated. Sometimes it's the smallest fact that leads us in the right direction. Emily nodded. Okay. I paused, then added one last thought. This isn't just about the lump, it's about your whole story. Let's make sure we don't miss a word. I sat back down beside Emily, opened my tablet, and tapped on a blank note. This is where the real work began. Diagnosis wasn't always about tests and machines. More often, it was about listening and asking the right questions. Okay, I said. Let's go through this carefully. I'm going to ask you a bunch of things, and some of them might sound strange or unrelated. Just answer whatever you can remember, even if it feels insignificant. Sometimes the smallest detail makes the biggest difference. Emily nodded, her hands resting on her lap. Her mother sat still, leaning forward slightly as if trying to absorb every word. Let's start with your general health. Any medical conditions you've been treated for in the past? Anything chronic? No, Emily said. I've always been healthy, never had surgery. I don't take any medications, not even birth control. Good. How about your family? Anyone with cancer? Autoimmune diseases? Lupus? Rheumatoid arthritis? My grandmother had breast cancer in her 70s. Other than that, no. Any siblings? 2 brothers, both healthy. Have you been sick at all in the last month? Cold? Flu? Runny nose? Sore throat? She shook her head. Nothing. I haven't even had a sniffle. Any fevers recently? No. Have you traveled anywhere in the last few weeks? Camping? Hiking? Different states or countries? No. I've mostly just been at work and home. Do you have any pets? A cat, she said. His name's Oliver. Indoor or outdoor? Mostly indoor. Sometimes he sits by the window. Has he scratched or bitten you recently? No. He's pretty gentle. I nodded, noting that toxoplasmosis or cat scratch disease seemed unlikely, but still good to check. How about any skin irritation, rashes, changes in deodorant or soap, shaving? She smiled faintly. Nope. I actually don't shave. Haven't in years. Have you noticed any other lumps anywhere else on your body? No. Fatigue? Unexplained weight loss? Nope. I feel completely fine, except for this lump. How about your menstrual cycle? Any changes in your period? Breast tenderness? Discharge? Everything's been normal, she said. No pain, no lumps. I paused, glancing over my notes. So far, nothing was jumping out. Did you have any recent injuries? Even small ones? A cut? A scrape? An ingrown hair near your arm or chest? No, she said again. Nothing. I could feel a subtle tension building in the room. She was doing her part, answering everything clearly, honestly. And yet, the picture remained blurry. I tried a different angle. Any changes in your diet? Supplements? Protein powders? No. Any dental issues? Tooth infections? Gum disease? She raised an eyebrow. No. I've never even had a cavity. Dr. Lin stood in the corner, quietly observing. I could tell she was feeling the same frustration. We were asking every logical question, covering every base, and we were getting nothing. I continued. Have you had any recent lab work? Yes, Emily said. I had a physical 4 weeks ago. Blood work was totally normal. Do you know if that included a CBC? Yes, she replied. White blood cell count was fine. That ruled out a few things. Leukemia, systemic infections. I tapped the screen slowly. How about vaccinations? I asked, not expecting much. Emily tilted her head. Like, ever? Recently, I clarified. Within the last few weeks. Oh, she said. Yeah, I got a tetanus shot about a month ago, and the HPV vaccine too. One in each arm. Which arm was the tetanus in? Right, and the HPV? Left. That made me pause. That was interesting. But the timing didn't match, I explained, mostly to myself. Usually, if lymph nodes swell in response to a vaccine, it happens within a few days, and they go down in about a week or two. This lump has been here for 5, Emily said. Exactly, so it's probably not that, but it's good to note. Dr. Lin chimed in. What about fungal infections? Could it be a deep skin fungus? I shook my head. No redness, no scaling, no itching, no entry wound. We were hitting walls, one by one. I closed my tablet softly and looked up. Okay, I said, let's take a breath. Emily's eyes darted between me and Dr. Lin. Her mother's hands twisted nervously in her lap. I'm not giving up, I said. I'm just recalibrating. I looked at Emily. You've done everything right, and so far, nothing about this case fits into a neat little box. That's not your fault. That's not anyone's fault. It just means we haven't found the right question yet. She swallowed hard. Is that bad? Not necessarily, I said, but it means we keep going. What are the possibilities? Her mother asked, voice cracking. I hesitated. It could be an inflamed lymph node responding to something we haven't identified. It could be a rare benign tumor. It could be something more serious. That's why we're being careful. Emily looked down at her lap. I waited a beat, then continued. Here's what we're going to do. I want to run through the options with you. We can start imaging, get an ultrasound or even a CT scan of the area. We can do blood tests again, or we can give it a bit more time. Monitor closely. See if it starts shrinking. If it doesn't change or gets worse, we escalate. Emily blinked. Would it be dangerous to wait? In most cases, no, I said, but we'll be watching closely. I promise. Her mother wasn't convinced. What if it's something serious and we lose time? I nodded. That's always the question, and it's why we don't take anything lightly. But overreacting can lead to unnecessary procedures. We walk the line. Emily nodded slowly. Okay, let's wait. 2 weeks. If it's still there, we do everything. Deal, I said. I stood up and stepped away, but something tugged at the back of my mind. A thread I hadn't pulled yet. I didn't know what it was, but it was there, waiting, and I had every intention of finding it. As soon as we stepped out of the exam room, I felt the weight of the conversation settle over me. Even though Emily had agreed to wait, I could tell the decision didn't bring her peace. It only bought her time. And for her mother, it hadn't done much at all. Mrs. Carter was already in the hallway, pacing slowly, arms folded across her chest, eyes darting toward the exam room door, like she might rush back in at any moment. I walked past her to give her space, but I didn't get far before I heard her voice, soft and cracking. Dr. Marcus? I turned. She looked up at me, eyes glassy. I know you're doing your best, she said, and I know Emily agreed to wait, but I'm scared. This doesn't feel right. She's never been sick. She's never had anything wrong. I nodded gently. I understand. I can't stop thinking about all the stories I've read online. Young people who had no symptoms, and then one day, a lump shows up, and suddenly it's cancer. I don't know how to shut that off. I gave her a moment, letting the silence hold her words. Sometimes rushing in with answers only buries the fear deeper. I'm a mother, she said, voice trembling, and I know what you're thinking. Parents always worry, but I've known that girl every second of her life. I can tell when something's different, and something about this. It's not right. She wasn't wrong. Maternal instinct was rarely misplaced, and though the science hadn't given us a smoking gun yet, my own instincts were tingling in the same direction. I'm not taking this lightly, I said. I promise you. We're going to monitor her closely. If anything changes, we move fast. No hesitation. But we also want to avoid rushing her into a biopsy or procedure that might not be necessary. Mrs. Carter took a deep breath. I know. It's just hard to sit still when it's your kid. I nodded. It's hard even when it's not. She gave a tight smile, wiped the corner of one eye, and sat back down. I stood there for a moment longer, watching as she folded her hands in. Her lap, staring at nothing, lost in 1,000 terrible what-ifs. Back in the hallway, Dr. Lin was waiting. She had stepped aside while I spoke to Mrs. Carter, but hadn't gone far. She looked shaken, less by the case itself than by the emotional weight of it all. This, I knew, was a teaching moment. "How are you holding up?" I asked. She looked down, then shrugged. "Honestly, I'm not sure. I thought I was ready for cases like this, but seeing her mom like that, it just hit me." "That's not a weakness," I said. "That's empathy. I just keep thinking, what if we're missing something? What if we're wrong?" I looked at her carefully. "Dr. Lin, let me ask you something. Have you ever lost sleep over a patient yet?" She hesitated. "Not until today." "Good," I said. "That's when you know you care enough to get it right." She looked surprised, then almost ashamed. "But shouldn't I be more objective?" "Objectivity and compassion are not opposites," I said. "You need both. You need to care deeply enough to feel the pressure, but think clearly enough not to panic." She nodded slowly, absorbing it. "Did you ever have a case you regretted?" I looked down the hallway toward Emily's room, then back at her. "More than one," I said. "You remember the ones you miss. You carry them with you. But you let them shape you, not destroy you." She didn't ask more, but I could see the question forming behind her eyes. What happened? Who was it? Not now. That story would come in time. Today, we had our own to finish. "You did good today," I said quietly. "You caught something worth attention. You brought it to me. You listened. That's how we learn." She smiled faintly. "Thanks. Come on," I added. "Let's get caught up on her labs from last month. I want to take another look." We walked back toward the nurse's station, the weight of uncertainty still in the air, but also something else, something steadier. A sense of shared vigilance. Emily wasn't alone. Neither was her mother. And neither, for that matter, was Dr. Lin. And somewhere inside me, deep below the white coat and years of experience, the echo of past mistakes kept me sharp. This time, I would not look away. That night, long after the clinic had emptied out and the hum of fluorescent lights had faded into silence, I found myself still at my desk, the glow of the screen casting long shadows on the wall. Emily's case hadn't left me, not even for a second. I tried to distract myself, reviewing charts, finishing notes, sorting through tomorrow's schedule, but her face kept slipping through the cracks in my focus. The way she said, "I just need to know it's not cancer." The way her mother clutched her hand, like she was the only thing holding her together. The mass I had felt beneath her skin, too large, too quiet. I leaned back in my chair, closed my eyes, and like an old wound breaking open, another face surfaced. One I hadn't seen in years, but had never really forgotten. Her name was Lisa. She was 31 when I met her, a wedding photographer with this contagious, caffeinated kind of energy. She talked fast, laughed easily, and kept her camera slung over her shoulder like a badge of purpose. She came in with a small lump on the side of her neck. It was maybe 2 centimeters, barely noticeable unless you were really looking. She told me she thought it was from carrying her gear. "I probably pulled something," she laughed. "It's fine." And honestly, at first glance, it seemed fine. Mobile, soft, no overlying skin changes, no fever. She denied fatigue, weight loss, night sweats. Her vitals were perfect, her demeanor even more so. We chalked it up to a reactive lymph node, probably from a viral infection she never noticed. I told her to keep an eye on it, to come back if it got bigger or if anything changed. She said she would, and she did, 6 months later. But this time the smile was gone. The lump had doubled in size. She was tired all the time. Her clothes fit looser, though she wasn't trying to lose weight. She had started waking up soaked in sweat. Her energy, her spark, was dimmer. Blood work, imaging, biopsy. Stage 4 Hodgkin's lymphoma. She started chemo 2 weeks later. I visited her once in the hospital. She still smiled, even then. Said I shouldn't feel bad, that she didn't even know something was wrong until it was too late. But I knew better. She died less than a year after that. Her mother called me personally, told me Lisa had passed peacefully, surrounded by family, with music playing in the background. Her favorite song, apparently. She thanked me for being kind. I didn't deserve the thanks. For months, I replayed every second of that first visit. Should I have ordered an ultrasound right away? Could I have done more? Pushed harder? Trusted my gut? It's easy to say hindsight is 20/20ths. But in medicine, Hindsight doesn't heal the ones we lose. It just teaches the ones who are left behind. Since then, I've always listened to that little voice in the back of my mind, the one that gets louder when something doesn't add up. I don't ignore it. I don't silence it with protocol or statistics. I let it speak. That's why Emily's case had me sitting here, long after the last patient had gone home. That lump, it didn't scream danger, but it didn't whisper safety either. It just lingered, like a riddle with no answer. And her mother's eyes, they haunted me. Because they weren't just scared, they were familiar. I stood up, stretched my legs, and walked over to the window. The clinic parking lot was empty now, bathed in the orange haze of the streetlights. A few leaves drifted across the asphalt, pushed by a wind I couldn't hear through the glass. Somewhere out there, Emily was probably lying in bed, unable to sleep, her fingers tracing the outline of that mass, wondering what it meant. And her mother, sitting just outside the room, praying it was nothing. Praying that this wasn't the beginning of something dark. I knew better than to make promises I couldn't keep, but I could make a vow to myself. Not this time. I wouldn't ignore the uncertainty. I wouldn't wait for it to prove itself dangerous. I would stay ahead of it. I'd ask more questions. I'd keep searching, until I found what I needed, or ruled out what I feared. I looked back at the chart on my desk. Emily Carter, age 24. No medications, no conditions, one lump, no explanation, and a mother whose voice I could still hear. She's never been sick. Neither had Lisa. The next morning I arrived at the clinic earlier than usual. The sun hadn't fully risen, but my mind was already racing. I'd barely slept the night before. Emily's case replayed in loops. Every answer she gave, every physical sign, every test not yet ordered. The question lingered like static. Should we wait or act? I sipped lukewarm coffee in the staff lounge, flipping through her chart one more time. Nothing new jumped out. Her vitals were stable. The lump hadn't changed. No constitutional symptoms, no obvious red flags. But the size, 8 centimeters, that alone wasn't subtle, and it hadn't responded to time. That was the part I couldn't shake. Doctor, Lynn knocked and entered quietly, tablet in hand. She looked like she'd had just as much sleep as I had, maybe less. She's back, she said softly. Emily? Dr. Lynn nodded. She said she couldn't stop thinking about it all night. She wants to talk more about next steps. I set my coffee down and stood. Let's go. Emily was already in the exam room when we arrived. She was dressed the same as the day before, sweatshirt, jeans. But something about her posture had changed. She was sitting straighter, her face calm but resolute. Her mother was next to her, holding a folder that looked worn around. The edges, printouts from WebMD or health forums most likely. I greeted them both, then sat on the small stool across from Emily. You came back early, I said. Emily gave a tight smile. I tried to wait. I just couldn't. I kept thinking, what if it's something and I lose time? Her voice was steady, but I could see the fatigue beneath it. She'd been carrying the weight of uncertainty all night, and it had grown heavier with every hour. I nodded. I understand, and I'm glad you came back. Mrs. Carter leaned forward, her voice barely above a whisper. We talked last night. We want to do whatever we need to do. Tests, imaging, biopsy, whatever it takes. Emily nodded in agreement. Even if there's a chance it's nothing, I'd rather know. I exhaled slowly. This was the turning point, the fork in the road, and it had to be handled delicately. Here's where we are, I began. We've ruled out many of the common causes. We've gone through your history, done the physical exams. Right now, we're standing between 2 choices. I held up 2 fingers. Option 1, we go down the diagnostic route. Imaging, probably an ultrasound first, maybe a CT scan depending on what we see. Blood work, repeat labs. If the results are inconclusive, we consider a biopsy. We'll get answers, but it'll be a process. Emily nodded. Option 2, we wait 2 weeks. During that time, we monitor. If the lump shrinks or softens, it's likely reactive, a benign lymph node, or something your body is processing. If it stays the same or gets worse, we move forward immediately. Mrs. Carter interrupted, her voice suddenly firm. Doctor, I know you're trying to be cautious, but I don't think we can wait anymore. She hasn't had a single symptom, except for this, and it's not going away. I looked at Emily. She met my eyes without flinching. I agree with my mom, she said. I want to get scanned. I need to know. I leaned back slightly, letting their words settle, and then I gave a small nod. "All right," I said. We moved forward. Dr. Lin looked up from her tablet, surprise flickering in her expression. She hadn't expected me to yield so quickly. But this wasn't about defensiveness or ego. This was about trust. Emily and her mother had weighed the emotional toll of waiting against the risk of testing, and they had made their choice. "I'll put in a referral for an ultrasound of the axilla," I continued. "We'll do a repeat CBC with differential, just to be safe. Depending on the results, we'll decide next steps from there." Emily nodded. Her mother visibly exhaled, as if she'd been holding her breath for 24 hours straight. Dr. Lin started entering the orders. I turned back to Emily. "I want you to know," I said gently, "we're not doing this because I think it's definitely something bad. We're doing it because you listen to your gut. That matters. Your peace of mind matters." Emily smiled faintly. "Thanks for not brushing it off." "I don't brush things off," I said quietly. "Not anymore." She looked at me curiously, but didn't ask. I stood to leave, but as I reached the door, Mrs. Carter spoke again. "Dr. Marcus?" I turned. "Thank you," she said, "for not treating us like we're overreacting." I met her eyes. You're advocating for someone you love. That's never an overreaction." And with that, we stepped out of the room. The path finally chosen, but the mystery still unresolved. Sometimes, the hardest part of medicine isn't making the diagnosis. It's choosing when to act, and having the courage to wait, or not. This time, we chose not to wait. It was only after we'd ordered the tests, after the ultrasound referral had been placed, after the repeat blood work had been scheduled, that it happened. I was standing at the nurse's station, reviewing some notes on a different patient, when something tugged at the edge of my mind. Not a thought exactly, more like a whisper, a detail I hadn't asked about, hovering just beyond reach. I tapped my pen against the countertop, staring at the open chart. Emily's vitals, history, physical exam, family background, vaccines. Wait, vaccines. I spun around and headed straight back to the exam room. Emily and her mother were still inside, chatting quietly, the tension from earlier finally starting to lift. Dr. Lin was standing near the door, scrolling through a list of imaging centers. "Emily," I said, stepping in, "I have one more question for you. I know we already talked about vaccines a little, but I want to be more specific now." She looked up, slightly confused. "Okay. Have you received a COVID-19 vaccine recently?" Her eyes widened. "Oh, yeah. 3 days ago. I felt a pulse of recognition in my chest." "Which arm?" She blinked. "Left." My eyes met Dr. Lin's. Her expression was blank at first, then slowly dawning with realization. "And the lump started when?" Emily thought for a second. 2 days ago, maybe day and a half. Just after the soreness in my arm went away. That was it. I could have sworn the fluorescent lights in the room got brighter, or maybe my brain just snapped into focus, because now everything made sense. "The vaccine," I said aloud. "That could be it." Emily's mother stood. "What do you mean?" I stepped closer to the exam table, feeling a strange mixture of relief and cautious optimism. Swollen lymph nodes are a known side effect of COVID-19 vaccines, especially the mRNA types like Pfizer and Moderna. The immune system responds strongly, especially in younger people, and lymph nodes near the injection site can swell as part of that immune activation. "But this thing is huge," Emily said. "Like huge." "It's uncommon," I admitted, "but not unheard of. Especially in healthy adults with strong immune responses. The body reacts vigorously to the vaccine, creates antibodies, activates T cells, and the lymph nodes become enlarged because they're processing all that activity. It's not a bad sign. In fact, it usually means the vaccine is doing exactly what we want it to." Mrs. Carter was blinking rapidly, trying to process. "So, you're saying this is normal?" "I'm saying it's a strong possibility," I clarified. "It fits the timing. Left arm injection, left axillary swelling, no signs of infection, no systemic symptoms, normal labs. It adds up." Emily sat back slowly, eyes wide. "Why didn't we think of that earlier?" "It's not the first thing people think of," I said, "especially with something this large. But it's why full history matters. Everything. Even a shot from 3 days ago." Dr. Lin looked stunned. "We almost sent her for a biopsy." I nodded. "Exactly. It wasn't that we were wrong to consider it. We had been cautious, for good reason. But sometimes, The most powerful tool in diagnosis isn't a scan or a scope. It's a question, the right one, asked at the right moment. Emily let out a long breath and actually laughed, more from tension than humor. So I don't have cancer? I never said you did, I smiled. And I still want to be cautious. We'll keep the imaging order, just in case. But now, we have a highly likely explanation. Mrs. Carter covered her mouth. I've never been so relieved to be wrong. I smiled gently. Me too. We laid out a new plan, conservative but confident, watchful, waiting for 10 days. If the mass began to shrink, we'd cancel the imaging. If not, we'd follow through. I reminded them both to delay any mammograms for at least 6 weeks post-vaccine. Swollen nodes could lead to false positives. It was a good teaching moment for everyone in the room. Before they left, Emily stood up and looked at me. Thank you, she said, for asking one more question. You're welcome, I replied. That's why I'm here. But the truth was, I was thanking her too, for trusting us, for being honest, for giving us time to find the answer instead of demanding certainty too soon. As they walked out, I felt that quiet satisfaction you only get once in a while in medicine. The kind that comes when instinct, knowledge, patience, and a bit of luck collide at exactly the right time. Dr. Lynn stood beside me, still stunned. We almost missed it, she said again. I nodded. Almost. She turned to me. What made you ask about the vaccine? I looked down the hall where Emily and her mother had disappeared, and I shrugged lightly. I just kept thinking, there's always one more question. The next morning, Emily and her mother returned, not because anything had changed physically, but because they had more questions. And frankly, I was glad they did. We sat in the consult room, the three of us. No stethoscopes, no exam tables, just chairs, a quiet space, and the need to fully understand what had just happened. This time, Emily looked less tense, though still cautiously reserved. Her mother held a small notepad in her lap, pen already uncapped. I just want to make sure we're not missing anything, Emily said. I mean, it sounds good, really good, but how do you know for sure that's all it was? That's a great question, I replied, and I want you to keep asking them. Because when it comes to your health, understanding is as important as outcome. She gave a small smile. Her mother nodded. So, here's the science, I continued. When you receive a vaccine, especially an mRNA vaccine like Pfizer or Moderna, your body treats it like an alert. The vaccine tells your cells to produce a harmless spike protein from the virus, and your immune system kicks into high gear. Okay, Emily said. I've read about that part. Right. What's less talked about is what happens next. Once your immune system detects those spike proteins, your lymph nodes get involved. They're like command centers. The axillary nodes, those under your arms, are especially active when the injection is in the deltoid muscle. They swell because they're producing and coordinating immune cells like B and T lymphocytes that respond to what they think is a threat. So the swelling means it's working? Her mother asked. Exactly, I said. That's the paradox. What most people see as a side effect is really an intended effect. Your immune system is doing its job. It's building protection. And for some people, particularly younger adults with robust immune responses, those lymph nodes swell more and stay swollen longer. Emily leaned forward. But 8 centimeters? That still seems crazy. It's uncommon, I admitted. But not impossible. Most reactions are mild and transient. But we've seen a growing number of cases, especially since the rollout of boosters and updated vaccine formulas. Some people just react more strongly. Their immune systems are overachievers. Her mother chuckled nervously. What's important, I added, is that your swelling appeared within 48 hours of vaccination, occurred on the same side as the injection, and has shown no progression, no redness, no heat, no spreading. That fits the pattern of post-vaccine lymphadenopathy. And how long will it last? Emily asked. Typically, 2 to 3 weeks, I said. Sometimes longer. But it should gradually shrink. If it persists beyond 6 weeks, or begins to grow again, then we revisit. But right now, based on timing and presentation, this is our most probable cause. Her mother finally let out the breath she'd been holding since yesterday. So, we don't need a biopsy? Not at this time, I said. We'll still keep the imaging order open, just in case. But unless something changes, we won't need to use it. Emily sat back in her chair, her shoulders visibly lowering. The tension that had hung like a fog around her for days began to clear. "I thought I was going to lose sleep over this for weeks," she said. "Turns out all I needed was one question." I smiled. Sometimes medicine is about the big picture, and sometimes it's about the one detail that changes everything. Her mother, still holding her notepad, didn't write anything. She just stared at me. "I read so much on the internet last night," she said. "So many horror stories. So many people who didn't catch things early. But I didn't read anything about this. About vaccines causing this kind of reaction. It doesn't get talked about enough," I admitted. "We warn about fever and soreness, but people often don't realize that lymph nodes can swell significantly, and when they do, it can mimic something serious." Emily nodded slowly. "I just wish I'd known sooner. I wouldn't have panicked so much." "That's completely natural," I said. "The fear you felt was valid, and coming in was the right thing to do. Any lump that big, regardless of the cause, deserves attention. You didn't overreact. You listened to your body." Her mother wiped her eyes gently. "I feel like I can breathe again." I gave a small nod. "That's what we want. We'll still keep an eye on it. We'll schedule a follow-up in 2 weeks, and if anything feels off before then, you come back." No hesitation. They both stood, visibly lighter than when they had entered. Before she left, Emily turned to me. "You were calm," she said, "the whole time, even when we weren't." I nodded. "That's my job." "No," she said, "it's more than that. You didn't just treat the lump, you treated the fear." I didn't know what to say to that, so I just smiled and watched them walk out, hand in hand. Exactly 2 weeks later, Emily walked back into the clinic, this time alone. She looked different, not in appearance, but in energy. The tension that had wrapped around her shoulders like an invisible cloak was gone. Her stride was lighter, her eyes were bright, and as she stepped into the exam room, I could already tell what she was going to say before she said a word. "It's gone," she said, grinning. "I mean, not completely maybe, but almost. I can barely feel it." I smiled. "Let's take a look anyway, just to be sure." She hopped onto the exam table, lifting her left arm with ease. No flinch, no hesitation. I palpated the area carefully, methodically, part out of habit, part to reassure both of us that we weren't imagining things. And sure enough, the mass was barely there. What had once been an 8-centimeter swelling was now a faint, soft ridge, shrinking, fading, like a story that was no longer trying to be told. "Textbook resolution," I said, stepping back. "That's exactly what we hoped for." She let out a laugh, the kind that comes not from humor, but from sweet, overdue relief. "I was checking it every day like a maniac," she said. "I think my mom was more obsessed than I was. She kept asking me to lie down and let her feel it like she was doing her own scans." "She loves you," I said simply. "Yeah," Emily replied. "She really does." She paused, then added, "We're both really grateful, you know, for how you handled this. You didn't rush us, but you didn't ignore it either. You gave us room to feel scared without making us feel stupid." I nodded. "You were scared for the right reasons. You did exactly what I'd want any patient to do." She looked down for a second, then back at me. "I know this might sound weird, but I'm glad it happened." That surprised me. "Glad?" "Yeah," she said. "Because now I know I can trust my instincts. I know my mom will always fight for me, and I know there are doctors who really listen." I smiled, not the polite kind, but the kind that comes from hearing something you'll carry with you. "You taught me something too," I said. Emily tilted her head. "I did?" "You reminded me how important it is to keep asking the next question. Even when the chart looks clean, even when the answers are almost all no, there's always something more to consider." She hopped off the table, pulling her sweatshirt down over her jeans. "So, I'm good to go?" "You're good to go," I confirmed. "Just keep an eye on it over the next month. But I don't expect it to come back." She reached for the door, then turned one last time. "You were right, by the way." "About what?" "Peace of mind matters." And with that, she left. I stood there for a moment after she was gone, hand resting on the counter, listening to the soft click of the door shutting behind her. In medicine, you don't always get closure. Sometimes your patients vanish between referrals, or move away, or stop showing up. Sometimes you never learn how the story ends. But today, I did, and it ended exactly the way I'd hoped. Some stories end with celebration, some end in silence. This one, though, this one ended in stillness, a kind of quiet understanding that things had gone the way they were meant to go. But for me, it didn't really end at all. I found myself thinking about Emily's case long after she'd left. Not because it had been dramatic or unusual, not in the way doctors sometimes tell war stories from the emergency room, but because it was so incredibly ordinary and yet so incredibly human. A young woman, a lump, fear, questions, and then the question that changed everything. What stayed with me the most wasn't the diagnosis, it wasn't the resolution, it was the way she looked at me right before she walked out and said, "Peace of mind matters." That line echoed in me, because in medicine we talk so much about outcomes, cure rates, diagnostic accuracy, lab results, but we rarely talk about the weight of fear, the kind that lives in the hours between discovery and diagnosis, the kind that wakes people up at 3 a.m., Googling symptoms under the covers, bracing themselves for the worst. We rarely acknowledge that sometimes the most healing thing a doctor can do is not write a prescription or schedule a scan, but to sit with a patient in the not knowing and let them feel safe there. Emily reminded me of that. She reminded me why I chose this field, not to solve every case, not to outsmart every disease, but to be present, to be human, to be the person someone turns to when they feel like the bottom is falling out. People often think medicine is about certainty. It's not. Medicine is about managing uncertainty, learning to live in it, learning to navigate it with humility and attention. We're not gods, we're not computers, we're people. Trained, yes. Experienced, hopefully, but still prone to the same fears, the same blind spots, the same limitations. The difference is, we choose to walk into uncertainty willingly, every single day. And when we do that well, when we do it with grace, we don't just give patients answers, we give them space. Space to ask, to doubt, to hope. I remember when I was a medical student, shadowing an old-school internist with over 30 years of practice behind him. He told me, "You won't be remembered for the textbook cases, you'll be remembered for the way you handled the gray zones, when the answers weren't obvious, and you still made people feel seen." At the time, I nodded politely. I didn't really understand, but I do now, because every patient who walks into your clinic isn't just carrying symptoms, they're carrying their story, their childhood, their beliefs, their traumas, their hopes. They're carrying someone they lost to illness, a friend who didn't catch it in time, a cousin who died young. They're carrying the weight of memory. And you have to make space for all of that, while also holding the stethoscope, reviewing the labs, clicking through the chart, checking boxes, and getting through your day. It's overwhelming sometimes, but it's also sacred work. Emily's case reminded me that the most powerful diagnostic tool I have isn't in my pocket. It's not on a blood panel. It's not even my training. It's my ability to listen. To really listen, not just to what's being said, but to what's being felt. To read between the lines. To notice the way someone grips their sleeve when they talk about cancer. The way they glance at the door when they're too afraid to ask the real question. The way a mother doesn't say she's terrified, but can't stop tapping her foot. Those are the signs that matter most. Those are the ones that don't show up in medical records, but tell you everything you need to know. And when you catch one of those signs, when you hear the unspoken, it can change everything. It certainly did for Emily. All it took was one more question, a simple one, about a vaccine, something that could have been easily skipped, easily assumed, easily forgotten. But it wasn't, because we slowed down, because we didn't rush to conclusions, because we chose curiosity over certainty, and in doing so, we avoided unnecessary procedures. We preserved trust. We gave her exactly what she came for, not just an answer, but reassurance. I know not every case will end like this. I know that sometimes the lump will be cancer, the cough will be something terrible, the fatigue will be the start of something we can't stop. But this one wasn't, and it reminded me that not every success in medicine has to be dramatic. Sometimes success is quiet. It's invisible. It's a mass that never had to be cut open, a test that never had to be ordered, a fear that never had to be realized. Sometimes success is a patient walking out of your office lighter than they walked in. Emily gave me that reminder, and I'll carry it forward, because I know there will be another Emily, another mother, another question, another room filled with worry and silence, and the hope that maybe, just maybe, someone will ask the right thing at the right time. I plan to be ready. Do you believe in intuition? I do. Not the magical kind, not crystal balls or gut feelings conjured from nothing, but the kind that comes from years of quiet observation, the kind that whispers instead of shouts, the kind that asks you to pause just for a second before moving on. Emily's story could have gone differently if we had rushed, if we had trusted only the data, if we hadn't asked one more question, but intuition nudged us, gently, persistently. And because of that, a young woman walked away with peace of mind, a mother got to sleep again, a resident learned the value of stillness, and I was reminded why I still love this work, even on the hard days. So now I want to ask you something. Have you ever had a moment where something just didn't feel right? A feeling you couldn't explain? A small voice telling you to look again, to ask one more question, to wait 5 more minutes? Maybe it was about your health, maybe about someone you loved, maybe it saved you from something, or maybe it brought you clarity you didn't know you needed. Those moments matter. They're not always dramatic, they won't always make sense at the time, but they are signals, tiny internal alarms that ask us to pay attention. Medicine is full of protocols, yes, but humanity lives in the gray. It lives in the pauses, in the things we almost missed. So I hope this story reminds you of something important. You have a right to ask questions, to speak up, to not brush off what your body or your heart is trying to tell you. And if a doctor ever dismisses that, find another one, because the best doctors I know aren't the ones who know everything. They're the ones who stay curious, the ones who treat uncertainty not as an inconvenience, but as a responsibility. That's what Emily's story taught me all over again, and maybe in some small way, it taught you too. So I'll leave you with this. If you've ever had a story like Emily's, a scare, a mystery, a moment when you listened to your gut, I'd love to hear it. Share it in the comments. Someone else might need to hear it too. And if this story helped you feel seen or safer or simply less alone, consider following. We have more true stories to come. Stories about medicine and mystery and what it really means to care. Until next time, stay curious, stay aware, and above all, stay human. Sometimes the things that save us aren't loud. They don't arrive with flashing lights or grand gestures. Sometimes they come quietly, in the form of a question, a gut feeling, a moment when someone chooses to listen, really listen. If this story left something with you, I hope it's this. Your story matters, your voice matters, and when something doesn't feel right, whether it's in your body, your heart, or your life, you have every right to pause, to speak up, and to be heard. Because sometimes the difference between fear and peace is one person who takes you seriously. Picture this. A young woman walking out into the sunlight, finally breathing. Again. Her shoulders a little lighter, her mother beside her, not because the world changed, but because they were no longer carrying the weight of not knowing. And now, I'd love to hear from you. Have you ever had a moment where listening to your instincts made all the difference? Or a time when a doctor or a stranger changed everything with one simple question? Share your story in the comments below. Someone else might really need to hear it today. If you found value in this story, if it moved you or reminded you of something true, don't forget to subscribe. We share real stories like this one, stories about medicine, mystery, and the moments that make us human. Because here, we don't just tell stories, we honor them.